Welcome, everybody, to another Clear Passage Facebook question and answer. And today's guest is phenomenal. I cannot wait until you meet her and listen to her talk. Today is Dr. Afua Bromley. She is with us. I have known her for a very, very long time. Thank you, Afua, so much for being our guest today.
Thanks so much for having me. I'm really excited, and it's always great to be able to do things with you. It has been a long time. We won't age ourselves, but a few decades.
Exactly, a few decades. So I'm going to tell you about Afua here in a second, but I have to tell you, she is one of the smartest, intellectual, compassionate, kind person that I've known. And she owns a clinic, and working with her, just the people involved in the clinic, it was just such a great, smart group of people getting together to work on each other. So thank you. You are brilliant, and I am just very, very honored to know you.
Well, thank you, because you were part of that group. So, I mean, it was all of us. So, yeah, thank you.
So let me tell you a little bit about Afua, because amazing. So Dr. Afua Bromley, she is the owner of the Acupuncture St. Louis and Wellness Center. It's a holistic multi-specialty clinic in St. Louis, Missouri, and I'm in St. Louis too. So for over 25 years, she has worked to promote equitable access to quality integrative medical care to those in underserved and disenfranchised communities. In addition to her private practice, Afua has also worked with multiple nonprofits for ensuring quality care to everyone. Afua received her BA from Washington University, which is a very prestigious school in St. Louis, her master's in Oriental Medicine in Florida, and did a postgraduate training in China. She received her doctorate of Chinese medicine from the Pacific College of Health and Sciences in San Diego. So like I said, she's really, really smart. Afua is the former chair of the National Certification Commission for Acupuncture and Oriental Medicine and co-wrote the rules and regulations for the practice of acupuncture in Missouri. So that's a real legislative thing, and it's phenomenal. She's also a fellow and a White House scholar in the Academy of Integrative Health and Medicine. You lecture nationally and internationally, is an adjunct professor at the Massachusetts College of Pharmacy and Health and Sciences, and you still occasionally lecture at Washington University too, don't you?
Once a year, yep.
So wonderful. So viewers, if you are watching, any questions about Chinese medicine, any questions about acupuncture, any questions about how acupuncture is affecting the stuff we do at Clear Passage, put them in the chat, and Afua and I will answer them throughout the chat, or at least at the very end. So please, the more questions you have, the more you're going to learn. So go ahead and tell all of us. So Western-minded philosophy, and then you have acupuncture. How did you make that choice between one or the other?
It was, first of all, I had wanted to be a doctor since I was 6 years old. And from that time, pretty much set myself up, because all I was really exposed to was outside of herbs. My mother's from Ghana, West Africa. So some traditional herbs, but really hardcore, I would say, Western medicine. And was on my way to medical school, and was sick. I lost my hearing for about 3 months and had taken antibiotics, had been to my physician, and my physician is like, I think, you had this virus, you lost your hearing, get over it. Basically, you still have one good ear. And a friend was dating an acupuncturist and had literally been harassing me almost weekly to let her significant other work on me. And I was very skeptical. Again, research at Washington University Medical School, pre-med, very hardcore, I would say, biosciences. And finally, we were at a picnic and he was there, and she said, will you let him work on you? He's got needles. And I'm like, okay, if you leave me alone, I'll let him work on me.
The price of party, right?
My first treatment was at a picnic table, and 5 minutes later I could hear. And I was just dumbfounded. because I was like, okay, I definitely did not believe this was going to help me. Um, I can hear, and very curious. So I, started asking him some questions, and he gave me this book called by this Japanese acupuncture physician who was also a physicist, called Layman's Guide to Acupuncture by Yoshio Manaka. And it was exactly what I needed to read. Having such a really strong chemistry background in particular, and physics, being able to read this book that explained it from the energetic model. So if we know that the entire universe is made of energy, explaining it from that basically physics background was like the light bulb. I'm like, okay, this isn't some, pseudoscience, some wacko, somebody, is just making things up. And that's why I read this book and decided, if I get, because I'd been waitlisted, I was number one, um, on the list. I was number 9. I got down to number 1. So I had a guaranteed spot for the following year. And I decided, rather than doing another post-baccalaureate program, I'll do acupuncture school and, for a year, and I'll know enough. Now, mind you, it's a 4-year program. And I'm like, I'll know enough. I'll have mastered it. So I moved to Florida, interviewed and got into acupuncture school. And right away, because you start didactic classes and you start observing in clinic, and you have to learn Western medicine too. It's not all Asian medicine because it still has a bioscience background, but what I was seeing in clinic was blowing my mind. And it was also because it's a different paradigm, was also really challenging for me to kind of unlearn some of how I thought about the body. But the things that I was seeing in clinic, I was just like, okay, this is what I want to do. Like, this is having so many different tools at my disposal. So I gave up my spot for medical school, which everybody around me was freaking out. My parents were calling me frantically, like, what are you doing? The medical school, actually, because I kind of hit it off with the women who were handling all the applications, and they were like, what are you doing? Okay, when you decide, you get a hold of your head, you come and let us know, and we'll make sure, you could start again. But that was, gosh, that was almost 30 years ago. So actually that was 30 years ago this year.
So you said something, and you said, even in your first year, you had to unlearn so much. And I think that's a big thing when we start talking about holistic treatment, alternative treatment, and Eastern treatment, is that instead of coming in with an open mind, it's almost like this unlearning.
Yeah.
Yes, for everybody else who's have not only the undergrad, but 5 years of medical, 4 years of medical school, right, and residency. And so when you said that, I went, oh, that's really interesting. You said even your first year, you were blown away. Can you give me a quick little story of just something that you saw that was just like, oh my goodness?
I will tell you the thing that really sealed the deal for me, because I was seeing, little things, and, people with back pain, or their back pain would go away. But this one thing in particular, because I was early enough in my observation and didactic that I wasn't treating, but we were following the doctors around. And so we would assist in whatever way. And this one particular physician was seeing a new patient who had lupus, and she had some vision issues, but really had downplayed it. Her primary complaints were really around achiness in the joints and fatigue. And we knew she had a little bit of vision issues, but she didn't say how much. And at the end of the treatment, he had moved on. Dr. who I was following, had moved on to the next patient. And he said, can you walk her back up to the front so she can sign the rest of the paperwork and pay? So I walk her up, and she's just kind of walking right next to me. And I handed her the paper to sign, and she took the pen, and then she looked, and then she started crying. And she was like, I was like, oh my gosh, like, what's wrong? And she's like, I can see my name. I haven't been able to see my name in years. So just after that one treatment, her vision had improved. And again, mind you, this is not her primary complaint. She was already feeling better, but it was not her primary complaint. And I was like, oh my God. So she's like signing her name and just like, oh my gosh, I'll be back next week. But that for me was to be able to make such a fundamental shift because, and again, I had been pre-med since I was a little kid. So I knew the trajectory of lupus. And if you have vision issues with lupus, you're generally not getting it back. And she had been on the meds. She had, was doing all the things. Acupuncture, a family member had said, why don't you try this? So it was kind of her last hope for maybe we can offer something. But for me, that was really, mind was blown. And that week was actually when I made my decision that I was going to finish school, because I also knew I would not even have that much in terms of really being able to understand the medicine and apply it so that I could have, start to get to the level of skill as my teachers in school. It's just, again, and I will say after 25 plus years of practice, you continue to learn and understand. Your understanding of the medicine continues to deepen. We know the basics when you start practice, but like with any profession, the more experience you get and the more you're able to reflect on that experience, it helps you to continue to be a better healer.
We noticed that with Clear Passage too, right? You hit it right on the head. You come out knowing the basic skills, but who do you surround yourself by? You surround yourself by an excellent team who keeps helping you problem solve this latest technique, this other way of doing something. Yeah. So I love your anecdotal story, and we all have those, right? Medical journals don't like anecdotal stories. Acupuncture gets a rep for being, a pseudoscience. So is there any type of research out there that's showing that debunks the myth of being pseudoscience and more sciencey?
I mean, there's actually over 20,000 research studies. And not just, over 20,000. And 20,000 was as of, I want to say 2020. There's been a lot more because globally, there are lots of people doing research on using acupuncture. And the studies are very, very diverse. I mean, we have people who are using MRI technology in order to basically demonstrate that the body changes after a series of acupuncture points. I'm actually a member of the Society for Acupuncture Research. I'm on the conference planning committee because we have an annual conference every year, both in the US. They alternate between the US and Asia. So, I mean, there is so much research. What I like to tell people when, people are like, oh, there's not a, randomized double-blind study on acupuncture. And it's like, it's kind of hard to have somebody not know that they're getting acupuncture done. There's something called sham acupuncture, but even the methodology behind that, is you still are getting stimulated on a point. So while that may be the gold standard for pharmaceuticals, where you truly can have a true placebo, it doesn't work for body-oriented things, even physical therapists, massage therapy. The model is not set up for that. So one of the things that the FDA, and I would say your more mainstream research is doing, is taking a second look at maybe we need to change what we consider, that a valid study and randomized controlled trials um, that are double blinded with acupuncture is probably not actually good. It's not an appropriate methodology for PT, for acupuncture, for
Right.
even
And
chiropractic.
we went ahead and some of our publications are phase two for the exact same reason. The double blind's very hard, but the phase two is very recognizable.
Exactly.
Yes. So
And we're
great.
doing that too. And there's, like I said, there's actually been a lot when I was chair of the NCCOM, our National Certification Board. One of the things that I actually was doing was responding to the CDC and Department of Health and Human Services with their request for more information, meaning that they wanted, with regards to specific syndromes and diseases, they wanted us to compile data on research and submit that. And that's actually why Medicare actually started covering low back pain for using acupuncture, is because of the data.
Thank you. Yes. So it is very interesting when people say there is no data or there is no research. Over 20,000 research projects, and get online, Google it, get on PubMed, and you'll find it. You are hearing. If you don't think there's research, you are listening to somebody who's telling you there is no research. So at Clear Passage, which we work with adhesions, but one of the big reasons people create adhesions is inflammation, right? Inflammation just is, and all those cells come in and help and create scar tissue. Can acupuncture help inflammation? And can you kind of explain how or why?
Sure. It absolutely helps with inflammation at a fundamental level, every point on the body. And there's literally there's over 1,000 points. There's over 400 fixed points, and then additional points that we call asha points. And that's kind of like loosely translated trigger points. But each point, in addition to having what we call a channel or organ function, is going to have a localized function, increasing blood circulation and decreasing inflammation. So again, so each point is going to have broader scope, but it's always going to have a localized anti-inflammatory effect. So one of the theories of techniques, and within Chinese medicine, within Asian medicine, there are a number of theories, which makes it so fantastic because you can apply different theories to get to what is the underlying root issue. And so, I mean, even if you have even the least amount of skill as a diagnostician, when somebody's got inflammation. So you at a minimum can work to decrease inflammation, which makes what we do with acupuncture, and we also have a body work component to Chinese medicine in addition to herbs and lifestyle and nutrition, but it makes it so complementary to things that you do at Clear Passage in terms of manually helping the body to decrease that inflammation. It's why there are so many complementary forms and modalities.
Yeah. And you said, if you have the least amount of skill, you can look at these points. And then you take somebody like you, who's been out 25 years, who has their doctorate, who seen, tens of thousands of patients. And all of a sudden, it's not just this point, but it's the whole system of points. Right. And then you're creating an entire change to the systemic inflammation and the local inflammation, right?
Right. Yeah. I mean, we want to get to the root.
So. The root. And so you also know that we deal with a lot of infertility, black tubes, hormones, endo. Can you talk about any of that and how acupuncture might affect all of that?
Sure. Again, we have the inflammatory component, which is significant. And in Chinese medicine, all the organs have same function as in biomedicine, but have an expanded function. So those different organ systems have an impact on every aspect of the body, including the endocrine system. One of the things, especially with blockages and adhesions, that we say in Chinese medicine, we call it a blockage of qi and blood often. So if something is blocked, whether it's qi or is blocked, your body can create adhesions. We know adhesions can be formed due to trauma, but stress is also trauma. So we see, there's a thing that we often say in the US, like so many people have liver qi stagnation, and it's just the amount of stress and you're holding on to all this tension, and that tension can be, and for women, especially in the breasts or chest with fibrocystic breasts, in the pelvic area. So that can look like endometriosis, ovarian cysts, fibroids. In the colon, it can look like IBS. It can manifest as that. Your torqued colons, it can manifest in all those things just without actual trauma to the physical body. You add in physical trauma, a fall, if you played sports, it really can be anything. And so we work on the underlying root issues. So we do work on stress. We say work on basically unblocking the blockages. And again, what you do, that manual manipulation is one way to do it. Acupuncture is complementary. The more tools that you give somebody and give the body to use, one, the quicker things actually change, but also the more effective and the more permanent the change is. So it's not just the physical body changing. Often you're looking at, and I know you've seen this with people, really, it's like their mind is free, their heart is free from those adhesions that were blocking a lot of physical and emotional things.
We actually even tell our patients that you might have an emotional release on the table because we are releasing this adhesion where your trauma might be kind of buried. Do you notice that with acupuncture too?
Absolutely.
Emotional releases and
Absolutely. I've definitely had people cry on my table, and not because they were in pain. They're crying. They're like, I don't know why I'm crying, but I feel so much better. But yes, absolutely. And it doesn't always manifest as that. It is, tears, but
or laughing or
laughing, right. It is this lightness of being and feeling like you're not so, put under.
Yep. Just a reminder to everybody, if you have any questions for Afua about acupuncture or for me about clear passage or anything in between, please put your comments in and we will get to them at the end of the show, at the end of this segment. So we've talked about, inflammation. We talked about infertility. We talked about adhesions and inflammation a little bit. We treat bowel obstructions and so bowel obstructions could happen because of tumors, and I cannot treat tumors, so maybe you can. Bowel obstructions can happen to volus, or because we're coming up into its accordioning itself into itself. I can't treat that. We treat adhesion related, so radiation and scar tissue and surgery and Crohn's disease, which is a lot of inflammation, right? A lot of inflammation. So can you treat bowel obstructions with acupuncture? Is it an adjunct therapy? Tell us a little bit about that too.
Sure. It can be an adjunct therapy. It kind of depends on what the particular issue is. So things like, IBS, we definitely see in terms of, typically IBS would be something that's acupuncture, herbs, and significant dietary changes. Same with Crohn's disease, because we need to heal the gut. We need to also help move those blockages and regulate digestion. So acupuncture can help with that, but often it's multimodality. Um, if there is a tumor, for example, people with colon cancer, my philosophy with colon, and I see a lot of oncology.
Yes, you do. She sees a lot of oncology. Yes.
I tell people if they can cut it out, tell them to cut it out. So we can deal with the adhesions afterwards. But with tumors, with malignant tumors, you always, my philosophy is cut it out, as long as they can do so safely. And
Because we're holistic. We're not
I am
myopic. We're holistic, right?
right, exactly. And I am into whatever works.
Yeah. Yep.
And so that you have the best quality of life, going forward. So my philosophy is always, if they can cut it out, let them cut it out, when we're talking about cancer. Because we can deal with adhesions, we can definitely deal with scar tissue. With benign issues, we often can also work on those in terms of, because for us, anytime you've got like a cyst or even a benign tumor, again, if it's an obstruction, cut it out. But if it's benign, there's a good chance that we may be able to help that to shrink. Because for us, we say it's a qi, phlegm, and these are all Chinese medicine concepts, but just think your body is growing something. It's because things aren't moving.
Yeah, something's off.
Something's off. So for us, working on decreasing that. But again, by the time somebody's got a bowel obstruction, I mean, I have talked more than one person into getting surgery, because I'm like, if this keeps going, like, you're going to die because you have this obstruction.
And she talked somebody into surgery because of a tumor. With a bowel obstruction itself, like clear passage, definitely we can work on that locations and pull it apart. So I totally 100% understood what you were saying, but I wanted to make sure
but it could come across. But yes, cancer cuts out.
Yep. So we were talking about how acupuncture could be a really beautiful adjunct to clear passage, right? With inflammation, infertility, adhesions, bowel obstructions. But can breaking up adhesions, could what we do help the flow of qi? Could it help acupuncture?
Absolutely.
How? Why?
So and this goes back to the different components of acupuncture and Chinese medicine, kind of what we call energy medicine. So there's many different tools. So a needle is honestly just a tool. You can use pressure, which is essentially what you're doing with clear passage. It's that manual manipulation. In Chinese medicine, we use something called Tui Na, which is basically the Chinese form of body work. It's Anma in Japanese medicine, but it is moving the qi, it is moving the blood, it is manipulating those movements with your hands. You can do similar things with herbs and food. And so it's just, what tools do you have to work with? And for us, it's always, you want to choose the tools that are most appropriate. And that may mean, and again, I said, the more tools you use, the quicker things move. So it's, especially when you're looking at that physical manual manipulation, sometimes even when you're done, say, seeing somebody and everything is moving, helping the body to eliminate kind of the waste products from that's something that acupuncture can also help with. And when we're thinking about complementary aspects of it, it may be that, when you're looking at somebody who's got a history of IBS, but also had bowel obstructions and adhesions, but we need to calm down kind of in general that aspect of the irritation of the bowels, which is, I would say 95% of the time, it's food and diet related, in addition to stress. So stress makes everything worse. But what I've seen is our diets in this country are pretty bad as a whole. And so looking at finding what is the irritant.
So we have a couple of questions here. The first question is on what part of the body do you do acupuncture for small bowel obstructions due to adhesions? And it's an acupuncture question, but I'm going to take it first from a clear passage perspective, saying every single individual is different.
Yes.
And so I do not know what your adhesions are due for, and every single person gets treated absolutely as an individual. Are your adhesions coming because of surgery from radiation? Are they being pulled down into the pelvis, pulling into the back? So everybody's very, very different. So that's the clear passes perspective, but I am not an acupuncturist. So Dr. Bromley, what do you do a specific point for small bowel obstructions?
And it still depends. For us, we do tongue and pulse diagnosis in addition to a very detailed intake, and we'll often do a physical exam, especially for that. So with the tongue and pulse diagnosis, I get a better sense of what's happening internally, organ system wise, because again, I want to get to the underlying reason of why. And a lot of times when patients are giving us information, if you've had surgery, that tells me one thing, but often if there's an emotional root and there isn't necessarily something physical that happened to you, then I need to figure out what the issue is in order to treat. So the points could be on your abdomen, but not necessarily. A lot of times I'm doing points on the hands. I may be doing points on the legs. So it all goes back to what is the underlying issue? And I talked about that diagnostician part. And in Chinese medicine, that's a real key component. It's why what we call cookbook acupuncture doesn't really work for a lot of complex things where, here are these points.
So I'm gonna stop you right here because you just hit something on the head, which I knew, but I was like, oh, that is so many people go to acupuncturists that had a year worth of training. My chiropractor is doing my acupuncture, and they're doing these by the book number things. Talk a little bit about, you were talking about diagnosing and tongue and pulses. How is that so much different in 4 to 6 years, the 8 years, the 10 years of training versus the
200 hours
45-hour course that I
200 hours. No offense to my chiropractor brethren, but the difference in training is significant.
Yes.
When you're looking at, I talked about having my master's degree, and my master's degree was actually based on the doctorate in China. So it was a 4-year program condensed into 3 because we went to school year round with between 30 to 35 credits per term. So it was heavy. And then the doctorate on top of that and my externship. So we're talking thousands of hours. At a minimum, you have to have 2,000 hours. At a minimum, most programs are closer to 4,000. And when you're talking about not just didactic, or classroom work, you're talking about in clinic observing lots and lots of patients. So by the time I had finished with what we were doing in China after I'd actually graduated, literally had seen a few thousand people, especially in China, just because we would have like 100 people a day. I mean, it was off the chain busy. But it was helpful just being able to see within the hospital system in China, just the volume of people. You get to see so many different things. So even though my student clinic,
you're assessing each person.
You're assessing each person.
Yeah. Tongue,
it was,
pulses, this, that, versus, back pain, we're doing these 6 points.
Yeah.
So each and every person is an individual.
Right.
Amazing. Amazing. The other question we have is, have you ever done injections for a bowel obstruction? If so, can you elaborate? And I know nothing about this, so I can't say anything, but do you, Afua?
I don't do injections. In some states, you can do injections. It's another level of training. And in Missouri, where I live and practice, it's not allowed. In Florida, actually got that into their licensure after I'd already moved away. In New Mexico, Florida, and maybe Washington State have injection therapy. I do know people who do it. I'm really not very knowledgeable at all, other than to know that people do it, and there's a host of things that you can do with injection. So I would have to defer to, unfortunately, I'd have to defer to someone else who has that information. But excellent question, because I do know that it's there. I'm just not well versed in it.
Thank you. Thank you. So as clear passage, I know acupuncture is usually fee for service. Now there are insurance that may pick up here or there, right? As people start to actually, I see more and more people willing to invest outside of insurance into their health. But if you have somebody come up to you and have that question of, well, you know what, this is really an investment. I'm not sure if I want to make it. I could be, going on vacation. I could be getting my nails done. Do you have a response to people who are saying, my insurance doesn't pay for it, and this is really a big investment?
I get it. I get it. What I generally will tell people is, one, I do offer some sliding scale. I do have to keep the lights on. So I can only offer that to so many people. But there are, outside of my own private practice, there is something called community acupuncture, which is a lot less. You don't have a private treatment room. You're in a large room with other people, and they're very good. But then you're looking at spending anywhere from, I would say your average is about $35 a session for that. But I do tell people, when things are important to us, we also have a tendency to find the money for them.
Find a way, yep. And
so investing in yourself is the best thing that you can do when you're talking about investing in your health. I also tell people, you might be the most wonderful, nice person in the world. I have a wait list that is long. So I'm going to try to get rid of you as quickly as possible and solve your issue and give you as many additional tools as possible so you can also help yourself and preferably help prevent any recurrence of whatever's going on. Now, that doesn't mean, for example, I have people who are, as I mentioned, I have a lot of oncology cases. So, once you're done with your treatment, often we're just doing that prevention. We want to make sure that your system is staying healthy. So hopefully you don't have a recurrence of cancer. So and I used to run an HIV clinic, those are people, this is what we want to do, is get you as healthy as possible and then maintain. So you're not looking at a weekly treatment ongoing forever. But, it's, again, we come up with what's going to make sense. But a lot of people I might see 2 to 4 times and then you're done. It kind of really, but I see the gamut in terms of the wide variety of things. Back pain, neck pain, those are, unless you've got some real damage, those can, but you lifted something too heavy, you woke up with a crick in your neck, you might come see me once. But again, it's an investment, and it's really a different frame of mind. Traditionally in China, you actually work to make sure you were preventing things instead of the disease model that we have here. So I do have people who they're like, hey, doc, I'm great. I want to make sure I'm great. So I'm coming to see you quarterly. I have a few people, I see them once a year. They're like, I feel good. I'm great. I'm just here for my tune-up, let you do the assessment, tweak a little things. and we go from there. So it really is up to you, where you have your investment. But know that generally speaking, like we want to get to the underlying issue so we can resolve those and you can move on.
I was listening to a speaker last night, the speaker series, and it was the 4-starred admiral. It was Admiral James Stavadish, and he retired, but Supreme Commander of NATO, Supreme Commander of the U.S. military. And he was talking about soft investment and hardcore investment. And he was talking about, peacekeeping missions is soft investment, and but the hard money is the military, which is so much more expensive than peacekeeping missions. Yeah. And he said, think about it this way. If you invest in your health and you exercise and you do your diet and you see your complementary medicine people and you take the medications that you're supposed to and you make those investments, then the cost of health care, your surgeries, the time off work, all of that's the hard medicine, the hard cost of medicine is going to be much, much less. So just that fun little story as you were talking about your
absolutely investment. Yes, what applies for the military and for foreign policy, good foreign policy is preventive. It's preventive. It nurtures relationships, and just like you're nurturing your body every day with what you eat, with what you drink, how you move, whether you move or don't move, if you get enough sleep, all those things. More and more research shows when you talk about longevity, it really is those things that we do on a regular basis that are in our best interest and have the best outcomes. Because it's really hard, that hard investment that you were talking about, Sharon, with the more major interventions. It's not pretty.
No, it's not pretty. And it affects everybody, your whole system, your family, the house, the health. Yes. But let's wrap things up and just go ahead and tell people, how can they get a hold of you if they want to make an appointment? Yes.
Sure. And I'm going to put a plug into, I'll tell people, since this is a national podcast too. So my practice is Acupuncture St. Louis, and you can find me at acupuncturestlouis.com. But for those of you who are outside the St. Louis area, if you go to nccaom.org, that's our national certification board. So that I was former chair of. We do the 4 board exams for practitioners to get licensed. There's a Find a Practitioner page, and that will allow you to find somebody who's nationally board certified in your area. So they've got at least, close to the same training or the same training that I have. But always ask other people as well, because, sometimes you need to have a good fit between you and another person. So that's nccaom.org. And then our office, we have 3 acupuncturists and 2 massage therapists, but it's acupuncturestlouis.com. And then a last plug for acupuncture research. For those of you who are interested in research, our website is acupunctureresearch.org. Lots of information.
Yes. And so there was a question here about treatment times. So Clear Passage has locations in Florida, New York, St. Louis, Dallas, Reno, and London. Our typical packages are usually 20 hours over a 5-day period. People come and travel to us. We have phenomenal results with small bowel obstructions and black fallopian tubes and infertility, anything adhesion related. So look us up online, clearpassage.com, or call our Florida office, and we have the phone number in the chat. So I do have to say, I know we've ran over time, but that's because of Afua and I just love to talk, and we could get our geek on all day long. So thank you very much for your time today. I so appreciate you, and I love you. Thank you.
Thank you so much for having me. We appreciate it.
All right. Goodbye, everybody. We'll see you at the next Facebook Q&A.